Okay, so in chapter 35 is over respiratory and cardiovascular disorders. Again, look over your key terms and abbreviations so you won't be lost as I'm going along here. So basically here we have cardiovascular and respiratory disorders are the leading causes of death in the United States. And with hypertension, which is high blood pressure, the resting blood pressure is too high. And this is due to narrow blood vessels, which are the most common cause, and signs and symptoms develop over time. But hypertension can lead to stroke, hardening of the arteries, heart attack, heart failure, kidney failure, and blindness. All right. Now, with hypertension, if it's high blood pressure, the systolic pressure is 140 millimeters of mercury or greater, and diastolic pressure is 90 millimeters of mercury or greater. Okay. Pre-hypertension is when the systolic pressure is between that 120 to 139 on the top. The systolic, and the diastolic is between 80 to 89. And a person, they call hypertension a silent killer for a reason, because a lot of times the person can have it but is not aware of it for many years, and while there's damage going on to other organs of the body. Signs and symptoms of high blood pressure would include like a headache, blurred vision, dizziness, and even nosebleeds. So you would want to make sure you report that for sure if your client's having those things. As far as lowering blood pressure, their diet should be low in fat and salt, a healthy weight. So if they're overweight or obese, exercise to reduce that weight, regular exercise at that, no smoking, limiting alcohol and caffeine, and managing stress, sleeping well, and certain medications can help as well. So basically a lot of lifestyle changes more than anything else. Coronary artery disease, they call it CAD for short. What happens here is the coronary artery disease are the arteries that feed the heart. Okay, they supply the heart with oxygen and nutrients. Well, they can become hardened and narrow over time, so therefore the heart muscle gets less blood and less oxygen. And the most common cause is what's called atherosclerosis. Okay, so the major complication of CAD is angina, which is chest pain. Okay, angina is known as chest pain. And what happens here is when we don't have enough oxygen in our heart complains and we feel pain. And if it's not, and if that blood supply is cut off, then in the heart, for the heart muscle itself, then we experience what's called a myocardial infarction or a heart attack. Another thing that can happen from CADs is irregular heartbeats, and death. It can have sudden death can occur, but the risk factors, the risk factors that can't be controlled is gender. Men are greater risk than women, age, family history, and race. African Americans are at greater risk than other groups. The things we can control. And the more risk factors you have, of course, the greater your risk. Okay, so the things that we can control include like our weight or exercise, high blood cholesterol that can be controlled with medications and a healthy diet. The hypertension, if you take your medication to help lower your blood pressure to the normal range, that helps. Smoking, we can stop smoking, and of course keeping our diabetes numbers under control. Once you have diabetes, you may not, you can't necessarily do anything about it, but you can keep you can follow your diet regimen and make sure that your blood sugar stays in the healthy range, which you don't have to know this, but 70 to 100. But basically, if you have just this condition, you need to make those lifestyle changes. Um, you know, you may not be radical, but you've got to do some, or you're just decreasing your lifespan here. Um, and then of course, I think that's really everything. Basically, we're trying to control blood pressure here. Angina, remember I told you angina is chest pain, and it's caused from reduced blood flow to the heart muscle. And it's just can be described having chest pain. The first thing you do is you have them sit down, or yeah, sit down, stop their activity. That's the first thing. Um, their chest pain, you want to ask them what it feels like, and they will describe it as tightness or pressure or squeezing or burning in the chest. Sometimes um, it's the symptoms are usually relieved by rest and a nitroglycerin tablet. And some persons actually wear a nitroglycerin patch to help relieve angina. Um, Things that cause angina are supposed to be avoided, such as overexertion, heavy meals, overeating, and emotional stress. And then chest pain, but if they take their medicine, like the nitroglycerin, and they can take so many over a certain period of time, but you don't have to know that part. But chest pain that does last longer than a few minutes and that's not relieved by rest and the nitro may heart attack is in progress, and so the person needs emergency care. So basically here is if that person complains of chest pain, you call for the nurse to come and assess it immediately. Don't wait till the end of the shift and say, oh yeah, by the way, type of thing. Oh, let me go back to angina one more time. When they do have pain, when they're talking about the pain, that pain can occur in the shoulders, the arms, the neck, the jaw, or the back. It can radiate, so it can go down the jaw, it can go down the neck, and go down the arms. All that can be common, especially in men. Women tend to be a little bit more atypical. The person will look really pale. They might feel faint and perspire, and they can have trouble breathing or even feel nauseated, tired, or weak. And then some persons complain of gas or indigestion. So we always err on caution side. And so a lot of times if they're having chest pain, send them out to ER for an evaluation. Okay. Why do we have them sit down and rest? Because that reduces the heart's need for oxygen. Okay. And we're trying to prevent damage and get them to the appropriate people. Now, if they have a myocardial infarction, which is an MI, the blood flow to the heart is suddenly blocked, and that part of the muscle without blood flow and oxygen dies. So an MI is an emergency. They can also experience sudden cardiac death that can occur, and an MI is also called a heart attack or an acute myocardial infarction or acute coronary syndrome, um, a coronary thrombosis, or coronary occlusion. Those are just all different names for MI, okay? All you need to know is myocardial infarction. But what we do is we make efforts to relieve the pain, restore the blood flow to the heart, stabilize their vital signs. We're going to give them oxygen to increase the oxygen that they do have available, calm them, because it's very, you think it's going to be upsetting, and then prevent death and life-threatening problems. Okay. And those signs and symptoms of a heart attack are also listed in your book. It's box 35-2, and it's on page 556, saying it a lot better than I just said it. But anytime that you have a person who says, I feel like I'm going to die, that is a time to go report it to the nurse because they need to be assessed. I don't care if they're calling it a bluff or not. Go get them because you never know when it was that one time that they're telling you the truth. Because I mean, I've had people who say, oh, I'm having a heart attack. They're not having a heart attack with something completely different. But you can't take that you can't take that chance. It needs to be reported immediately. All right, so make sure you look over that box 35 too. I won't have a lot of questions from these disorder chapters, but you're going to have one, at least one from every chapter. So I'm just telling you now, that's why you need to study some of these things. Okay, so CAD, angina, and previous MI are all risk factors. And of course, we need to make sure that they seek medical or attention. And sometimes they have to have surgical procedures to alleviate those blockages. No, and sometimes it'd be like oh, a heart cath, or it may even be open heart surgery. So it just depends on the severity that's happening here. And mainly we send them to the acute care setting where they get that care. But the goals here are to prevent another MI, prevent complications such as heart failure or sudden cardiac arrest, and then, of course, eventually get them back recovered and to resume their normal activities. Congestive heart failure is another type of heart condition, and it's mainly known by CHF, but some people do say heart failure, but they're both the same. But it basically occurs when the heart is weakened and it can't pump normally, okay? And there's left-sided failure or right-sided failure. And so the left-sided failure, the heart can't pump the blood normally, so it backs up into the lungs. What I have here is blood backs up into the lungs and they get pulmonary congestion, and they have difficulty breathing, and they have a lot more sputum. They'll be cough. I think even have a gurgling sound in their lungs, or sometimes you can hear it. And the rest of the body doesn't get enough blood and oxygen. So and the sign, so you might get other symptoms that occur with other organs of the body. If they have right-sided failure, the blood backs up into the venous system. Okay, so it stays in the veins. It can't get up to the heart and where it's supposed to be. So right here's the feet and ankles usually swell, or the neck veins will bulge, and they get liver congestion, which will affect the liver function. And sometimes the abdomen will be congested with fluid. Remember those ascites I was talking to you about in liver problems? They can get that. So the right side of the heart basically pumps less blood to the lungs, but normal blood flow does not occur from the lungs to the left side of the heart. So then you can get into left-sided failure too. But basically, all you need to know is that it's going to be causing the problem and the heart does not pump effectively. Um, so because the blood isn't pumping effectively, it doesn't get enough to the brain. So they can experience confusion or dizziness or fainting. The kidneys will produce less urine because the kidneys require a really good blood supply. And the skin looks pale and their blood pressure will fall. And a very severe form of congestive heart failure is known as pulmonary edema, which means there's fluid in their lungs. And this usually is, again, an emergency, because if that fluid doesn't stop filling up their lungs, they're going to die. So we usually have to send them out to the acute care set to a hospital for more intensive treatment. So on this slide, this is just some causes of what causes congestive heart failure. The treatment, though, includes we do give drugs to strengthen the heart and reduce the amount of fluid in the body. This is the person who's going to be on that sodium-controlled diet. They even may have to have supplemental oxygen. We want to sit them in semi-Fowler's position, and then, of course, reduce any coronary artery disease risk factors that we can. So that's usually a lifestyle change. Okay. Now, respiratory disorders. with respiratory disorders, again, you just have to remember the lungs bring oxygen. Um, the respiratory system brings oxygen into the lungs and removes CO2 or carbon dioxide from the body. So anything that interferes with that can, interfere with our life because we need air. So COPD is one of those conditions, and there's two disorders that are grouped under COPD. It's kind of COPD is like a big umbrella. There's a few things that's listed under it, and one of those is chronic bronchitis and then emphysema. So COPD is also another leading cause of death in the United States, but cigarette smoking is the most important risk factor for this disease, okay? So not smoking is really the best way to prevent COPD. And of course, it doesn't have a cure. Um, and don't just think it's cigarette smoking either. When I say cigarette smoking, it's any smoking tobacco product, cigars, pipes, chewing tobacco, any of that. It's all can be irritating. So, and exposure to secondhand smoke. So just because you don't smoke, if you have someone who smokes in your house, then you can be exposed to that smoke, and that would be your secondhand smoke, secondhand exposure, I should say. So, come on, bronchitis. This bronchitis, or bronchitis occurs after repeated episodes of bronchitis. And bronchitis just means there's an inflammation of the bronchi, and smoking's the major cause. So infection, pollution, and industrial dust are also risk factors. So even if your environment and your working environment can affect your lungs as well. But smokers cough in the morning is often the first system, because all that stuff is laid there. And then the cilia, God bless their souls, little hair-like extensions, try to get all that mess up, and they have a cough. And my mother used to she smoked for 20 years. And every morning, she had the smoker's cough. And she'd be in there in that bathroom coughing and coughing and coughing, getting all that stuff up. It was horrible. It was horrible for me to listen anyway. But thank the Lord she did stop smoking. But treatment involves the person needs to stop smoking. We don't try to judge a person. I don't judge a person who smokes, but I still have to tell them about the detriments of smoking, whether they want to stop or not. It's still that's my responsibility. So we just encourage them to stop smoking. Sometimes they end up on oxygen therapy or breathing exercises. They're at risk for more in respiratory tract infections. So we try to prevent them. And then, of course, if one occurs, we want to give them prompt treatment as possible. Okay. And even the cough that they have, what they do get up, this is sputum that they're getting up, so make sure you wear your PPE. That mucus, you would want to report what it looks like, because here's the thing: when it gets infected, it can have pus in it, and you might get a little bit of an odor to it, and the cough becomes more frequent. And with all that extra mucus and inflamed breathing passages, see they can't get the airflow in, then that's what you would want to report. So as much as nasty as it is to look at it, sometimes you do occasionally need to look at to make sure that your patient, it's not changing, and that we're not catching it as early as we could if there's a problem that's developing. The person usually does have difficulty breathing with bronchitis, and they tire really easily. And that's all because they just can't get enough oxygen in. With emphysema, in emphysema, it's a slightly different. The alveoli, which is where the gas exchange occurs in our lungs, these alveoli enlarge and they become less elastic, so they don't deflate like they should. So some of the air is trapped in there when they exhale. And so there's not a good O2 and CO2 exchange, and that can even occur because of the alveoli, because of the damage that's been done to the alveoli. And smoking is the most common cause of emphysema. And what happens, the person over time, even their diaphragm, their ribs change shape. So the person gets this barrel chest, and it's more of a kind of straight line. Like when you look at your ribs, they kind of go in an angle. Well, a person with emphysema has a barrel chest, so it widens around and it looks like a barrel. And they get short of breath and they have a cough. Um, they usually breathe easier when they're sitting upright and slightly forward, so they can usually kind of lean over the overbed table. And so they have like what they call a tripod look. It's this triangular look, and that's how they breathe the best. But of course, again, the treatments would be we want the person to stop smoking, and of course, they might get respiratory therapy or respiratory breathing exercises, oxygen and medications. All that stuff is ordered. Again, they can have a productive cough, a sputum that contain pus. So you would want to, again, make sure if they're coughing up something that you look at it every so often so you can make sure that if you see there's a change to report that. And again, because they don't get oxygen as much as the oxygen that really they should, they tire very easily. They fatigue. Most emphysema patients kind of look thin. They get very thin, and chronic bronchitis persons, they usually tend to be overweight. And it's all because of their breathing. And that's part of it's because of their breathing. All right, asthma is another type of respiratory disorder, and asthma is when the airways become inflamed and narrow, but it's due to um, it's a it's not an allergy response, but it's a response by the body to some irritant. It's an over response, but extra mucus is produced, and the symptoms can be mild to severe, but they have really bad difficulty with breathing. They will wheeze. This is a particular one that they have a certain sound to their respirations, and it's called wheezing, and they can cough, and they have pain and tightening in the chest. So asthma is usually triggered by allergies. Remember, it's that hyper response to allergies, and sudden attacks can occur. And asthma is treated with medications, and of course, severe attacks have to require emergency care. So with asthma, um, and the allergies can be anything. The allergies are the triggers, but the triggers can include anything like air pollutants or irritants, smoking, or having secondhand smoke nearby, respiratory infections, exertion, cold air. They can all trigger asthma, even exercise. And a lot of times, if exercise is the trigger, they'll take some medicine beforehand to reduce that uh, attack, prevent it rather. So the person really gasps for air and they get very, very frightened. Anytime that your airway is affected, I mean, people freak out. And who wouldn't, if you can't get your air in? But they do gasp for air, and they get very frightened, extremely anxious, and basically we try to control asthma. Sometimes if it's in children, they can grow out of it, but that doesn't always occur. Flu is next. Influenza is a respiratory infection caused by a virus. Okay, can't give an antibiotic to a virus because antibiotics kill bacteria. Um, and for bacteria. So we don't have a cure for the flu. Okay, so most deaths occur from flu occur in the older persons, again because their immune system can't handle it. Older persons may not have typical signs and symptoms of flu, but so you would want to be looking for changes in mental status or worsening of other health problems. They might have a body temperature that's actually below normal range instead of high. They get tired, fatigued, and they have a decreased appetite and fluid intake. So if they are diagnosed with flu, which flu is very contagious, we have to follow standard precautions. If it gets too much, we'll usually put up you'll see signs on the door about talking about the flu, or that we're trying to prevent this. But treatment involves for the person who has the flu, fluids, rest, and relief of the symptoms because they're going to have to endure. Hopefully, we can get them to endure it, you know. But drugs for the symptom relief and to shorten the flu episode. We do have some flu medications out there that usually help reduce it. It doesn't cure it, but it can reduce the length of the episode. But flu viruses are spread through coughing and sneezing. So again, standard precautions, wear that mask if you need to and when you need to. And the flu vaccine is the best way to prevent disease. So usually around October, even though the flu season is from August to May, most of the residents usually get their flu shots in October. And we try to get them to take the flu shot to help prevent. Now, does that prevent every form of flu? Absolutely not. But it's the most prominent strains that are out there that we vaccinate against. So if they should get another type of flu, hopefully it won't be near as bad. And secondly, you can't prevent because virus mutates. That's why they have a vaccine every year. They're very good at it. Then there is pneumonia. And pneumonia is an inflammation or infection of the lung tissue. And these affected tissues fill with fluid. And they can be caused by bacteria, it can be caused by viruses or some other microbe. But the person really, really is very ill. And of course, the children less than 2 and the older people greater than 65 are at the greatest risk. Signs and symptoms: high fever, chills, painful cough, chest pain on breathing, and rapid pulse, shortness of breath, rapid breathing, cyanosis, sputum that's thick and white or green or yellow or rust colored. They can be nauseated and they can have vomiting or headache, tiredness, and muscle aches. Doesn't that sound fun? But basically, when the lung tissues are filled with that fluid, then oxygen and CO2 exchange is affected. Older adults, again, are at the greatest risk from dying from pneumonia. And risk factors would include smoking, aging, stroke, bed rest, immobility, chronic disease, and tube feedings. Pneumonia from aspiration is common in older persons as well because they don't have a good cough reflex as much as they used to. So they're at risk for that aspiration. But I have to tell you, older persons may not have typical symptoms. Even though you see the signs and symptoms, they may not have the typical ones. So look for signs of confusion or dehydration or rapid respirations. Sometimes those are the atypical types of signs. But for as far as treatment goes for pneumonia, of course, there's going to be some medications ordered. We need to increase their fluid intake to thin the secretions and for the fever because temperature increases our fluid needs. They might have to have some IV therapy or oxygen therapy. Don't lie them flat. You can't breathe well lying flat. Semi-Fowler's position eases their breathing. Of course, a lot of rest, following your standard precautions, and sometimes we do have to put them in isolation depending on the cause of the cause of the pneumonia. So it might be some form of transmission-based precaution that you're going to put them in. TB, tuberculosis, is a bacterial infection of the lungs, and it's spread by airborne droplets with coughing, sneezing, speaking, singing, or laughing. Now, risk factors include a close, frequent contact with an infected person, living in close, crowded areas, age, poor nutrition, and HIV infection. So usually a chest x-ray and TB testing can be done to detect the disease. Now, if we give a TB skin test, that is just a testing tool. It just means that's why we have a TB skin test. Now, if you've had a reaction to it or to the TB derivative, then you might have to have just a chest x-ray. But what we're looking for is no active disease on a chest x-ray. And if the TB is positive, it's called an induration. And nothing that you have to know, but the main thing here is that if they're exposed, they're going to notify everybody who's been in contact with this person. So you might end up getting an additional TB skin test at some point in your career. But if it's been detected as far as like, oh, had some form of exposure, they do more testing to see if you actually have active TB. Um, and if you do, if we think you suspect you have active TB, or they're not sure, what they do is they send the person to the acute care setting where they can be put into a negative pressure room. Because remember, TB, you have to have the special respirator mask on. But medication, if you were to have it, if this person had it, they're going to give them medications. And these medications have to be taken for like months at a time. It's not just a couple of weeks, 7 to 10 days. We're talking like 6 months down the way. Um, but the mouth and nose are covered with tissues when the person sneezes, coughs, or produces sputum. Of course, hand washing cannot be stressed enough. And then, of course, following your standard precautions and your isolation precautions. Um, Also, TB, any communicable disease, is reported to the health department. So, again, you don't have to worry about that, but it's just for information only. But the signs and symptoms of TB, I want you to know, are tiredness, fatigue, loss of appetite, weight loss, fever, and night sweats. Cough and sputum increase over time, and then chest pain can eventually occur. Um, and then, they called this the wasting disease because it was, once TB progresses so far, all the person do is concentrating on breathing, and they would uh, their since their appetite would be decreased, they would start to lose weight, lose weight, lose weight, lose weight, lose weight, and they'd become emaciated. But the disease overtakes them eventually. Now, tuberculosis can actually affect other organs of the body, but it likes the lungs the best. So, and that's really all you got to know about that one. And then we're at quality of life. And, a person's condition can change at any time. And we want to try to be there to help them out through that trial and hopefully get them back to where they were before. Um, and you can read over the rest of that. And I think that takes care of this particular chapter. See you.